forum series titled Spotlight on Public Policy is brought to us with support from the Center for Community Solutions, and today's chapter, The Opiate Epidemic, is brought to us with support from Cardinal Health. Please help me thank all of our sponsors and welcome the President and Executive Director of the Center for Community Solutions, John Corlett, to the stage to introduce our speakers.
Thank you, LaCory. It's my pleasure to represent the Center for Community Solutions here this afternoon as we support the mission of the Columbus Metropolitan Club to engage people and ideas in community and conversation. For over 102 years, the Center for Community Solutions has brought research and analysis to bear on some of our communities and states' most pressing social problems. We are a nonprofit, nonpartisan think tank focused on solutions to health, social, and economic issues. It's hard to imagine a more tragic event than the loss of a child. Unfortunately, lethal doses of opiates and other drugs are causing death at an alarming rate in Ohio and around the nation. With the consequences of lost lives, crime, and other casualties leaving deep scars across our landscape, this epidemic shows no mercy and no bias of race, class, age, income, or family situation. It's a problem for all of us. Among the frontline witnesses to this scourge are the medical community who treat the victims and the journalists who cover the stories. So please join me in welcoming a man whose life work has been on the front lines of addiction, providing services to those in need, CEO of Maryhaven, Mr. Paul Coleman, and our host today, the star of All Sides with Ann Fisher on WOSU 89.7 NPR News, Ann Fisher. And starting us off, an American journalist known for his reporting and true tales about immigration, culture, money, drugs, and politics of the people of Mexico and the United States, our honored guest, author Sam Quinones. Sam will make opening remarks and then join Paul and Ann for conversation. Sam, the podium is yours.
All right then, how's everybody today? Good? All right. It's just wonderful to be back in Columbus. I see several people who helped enormously on this book, and I want to say thanks to great cop Gary Cameron back there, the Schoonovers, Ellen and Paul, somewhere. And Jennifer Bidinger, where is she? Right over there. It's, again, wonderful to be here again. You know, when I started this book, well, really in serious, began writing a proposal and then sold a proposal to a publishing house, middle of 2012, I remember telling people about it. And they would ask me, oh, what's the book about? And I would say heroin. Kind of bright-eyed and bushy-tailed, heroin. And I remember getting these really strange looks, like, why would anybody want to write about heroin in America today? It's not a problem that I'm aware of, these people would say. And I had sisters-in-law in suburban Indiana who had no idea what heroin actually was. And why would you be writing about this? This is kind of mystifying idea. And I lived with that uncertainty for a good amount of time, understanding that I kind of contracted myself and my family to write a book about a problem that apparently nobody thought was important or interesting or worthwhile. And here I am today. I think we could see what's happening in this country, all across the country, and not just here. Has been unprecedented in many ways and extraordinarily alarming and connected, I believe, to American culture. I thought for a long time that I was writing a book about heroin. And really, I believe I came to realize, in fact, that I was writing a book about America and American society and the nature of the country today and who we are as a country. And in fact, I believe that heroin is a kind of the the end result or the crystallization of values that we have fostered for 35 years. I believe that heroin's natural habitat is in fragmented places that have had community shredded. I focus, of course, in the book on Portsmouth, Ohio, which has gone through that quite severely, probably as severely as any town in the country. But you find this problem also in very wealthy parts of America, Charlotte, suburban Charlotte. And the common denominator, I've always asked myself, what's the common denominator? One is, of course, everyone's white. The addicts are all white. Everybody who is addicted, I've not found one person, well, I found one person, I'm sorry, who was not white, who was addicted in the last wave of addiction. But the thing that really also held everything together was destruction of community. I believe that is what has paved the way for this. In towns like Portsmouth, of course, it's job loss, deindustrialization, jobs going to Malaysia or Mexico or wherever, just disappearing altogether. The destruction of the beautiful pool, Dreamland, which became kind of the centerpiece of the book, quite unexpectedly. I had no idea when I started this book what the title would be, nor had I even an inkling that the pool ever existed. But it became kind of the focus of the book because the pool was what held life together. Civic life revolved around this enormous, gorgeous swimming pool where there was always kind of room for more people. The person who owned it for many years was the CEO of a local shoe factory. He didn't really need the money for the pool. He reinvested back into the community. The pool grounds kept on growing, and the pool itself became the central plaza, the social plaza for the entire town. Life itself revolved around this pool. Kids would grow up. As a toddler, you'd be in the shallow end, and the middle school, you'd be in the middle end, and then at high school, you'd be jumping off the high dive, and then early adulthood, you'd lose your virginity out in the grounds around the pool, and by the time your kid was born, they'd be back into the shallow end. That's how life happened. Everyone looked out for one another. You had 100 babysitters every time you walked onto the pool grounds. And the story, of course, of how that ended was a very, very sad one, I found. And particularly sad, my wife cries at Hallmark cards, but these kinds of stories really bring tears to her eyes, and my own as well, to see what happened to Dreamland, but really what happened to community in America. That's why I chose that pool and that town to write about, because that is a symbol for us all. Charlotte, suburban Charlotte, suburban LA, our heroin beltway is the wealthiest suburbs of LA, Simi Valley, Thousand Oaks, Moore Park. You may have heard of these places. I don't know, but they are very, very nice places and extraordinarily ravaged by heroin addiction today. Destroying community that's like heroin's. A town where there is no community, where isolation exists, where suburbs have been built into isolation has been built into suburbs, and we call it prosperity. That's heroin's natural habitat. Places where people don't know each other. You can be on the internet talking across the world with somebody and not know who's across the street from you, lives across the street. Your kids don't go outside. Dreamland gets destroyed in 1993, gets covered up, and is now a strip mall. These were all stories that, to me, talked about how this happened. It happens when we fragment, when we isolate. And to me, it's no coincidence. It's really no coincidence that in this day and age, now, the final expression of all that is widespread heroin abuse. Because we as a country have turned our back on what's most valuable in favor of what is most valued, in a sense, or prized. Big houses and all the rest. And I think that is a big part of it. Of course, there's poor communities like Portsmouth that have gone through their own destruction of community. But it's also in Portsmouth, I think, real quickly, I don't want to take too much time because I know we have a lot of things to talk about here, and I want to hear questions from you all. But the reason I also focused on Portsmouth was because there is where, after what, 30 years, 35 years of destruction of community, you are also seeing some really exhilarating signs of American resilience. And the great tendency in America to take control of your future. Instead of just, as the town did for many years, leave it to somebody else, leave it to financiers on Wall Street, leave it to the Chicago School of Economics to tell them that they weren't worth anything. The town is now, seems to me, in certain very important ways, to be saying, we're going to take control of our future now. We're not going to allow these things. The saving of the shoelace factory in Portsmouth, I thought was extraordinarily important in that. The reform of city government is also very important. They're saying we're going to be professional, we're going to be modern about this, we're going to use modern municipal governance now to run this town and not have it be kind of improvised and just shoddy the way it was, frankly, for several decades. And of course, along with this, you get now in Portsmouth, last time I was there, a recovery population. That's about 10% of the town. 2,000 people, when I was last there, were in recovery for opiate addiction in the city of Portsmouth, Ohio. That is an amazing thing. It's also very, very healthy for one reason. Portsmouth is getting an injection of what in other places is given to towns by Mexican workers. Mexicans, I spent, as John said earlier, I spent a lot of time in Mexico, wrote 2 books about Mexico. Mexican immigrants are barometers of economic health. No Mexicans in New Orleans before Katrina, for a very good reason. No Mexicans in Detroit. Mexicans go where the jobs are. They bring a lot of things and a lot of costs, it's true, but they also bring a lot of energy, dynamism, and willing to walk through walls, to get ahead, to do anything, gratitude for a chance at remaking their lives. And strangely enough, that's exactly what people in recovery also bring. So it's dawned on me when I was down there in Portsmouth, it's almost as if people who are in recovery are kind of like a new workforce moving into Portsmouth. Same people, same bodies, a new attitude. And that is why I also went back, spent a lot of time in Portsmouth, because I think that town can show us a lot about where we can go. There's a ton of problems in that town. But, and it looks awful at times. I went down there the first time going, yikes. I'm not sure this is my country. But I kept going back and I found out it was. Very exhilarating way. You know, it was taking control of its future in the way that heroin does not like, in the way that heroin seeks to undermine. Heroin is all about negativity, fatalism, you can't do anything, I might as well get high. And so, my feeling is that one of the reasons I came to this area is because this is a big part of where it started, and I think in some areas, in some cases, you can see that perhaps this is also where you find a solution out of it. With that, I think I'm just going to end, and I'm not sure what we do next, except for I sit down and we all talk. Great. Thank you.
You know, I've done shows on, I've been on the air for 6 years now. I've done shows on the heroin addiction problem in places like Worthington. We had the chief of police on the show, right? I've done shows about the pill mills problem down in southern Ohio and across the state as it swept the state. When I talked about the pill mills and the opiate addiction through the pill mills, nobody mentioned heroin. And when I did the show about the heroin addiction problem in nice suburbs like Worthington, nobody mentioned oxycodone. Nobody mentioned OxyContin at that time. Paul Coleman, can you kind of connect the dots for us real quick there?
Yeah. The dots are easy to connect. Understand that we're talking primarily right now in our community and throughout the state about an epidemic of heroin. That is a natural opiate. But there are other opiates that are available. They're synthetics, OxyContin, Vicodin, Fentanyl. Those kinds of drugs are available, and particularly the prescription drugs get a lot of people started using opiates. I might, by the way, add, and it's important, particularly when I see some people in this audience who have been materially helpful to us in the recovery services business by reducing the supply of opiates. They're here today. And I just want to tell you that the Ohio General Assembly, as well as the administration of the governor, and particularly the Attorney General, have been extremely helpful in reducing the supply of prescription opiates. But, Ann, your question is right on point. They go together, and just a quick story, and then I'll turn it back to you. A typical adult patient story at Maryhaven used to go like this at the beginning of the real epidemic. About a year and a half ago, I hurt my back, so I went to get a prescription, and I found that it worked pretty well, and I found it worked really well. And then my physician said, you know, we need to wean you off a little bit of it. And then I found another physician. And then that physician started to wean me off. And then somebody said, you can get it on the street. And you could, but it was expensive. And then someone said, but it's really just heroin, and heroin's a lot cheaper. And I had one patient at Maryhaven tell me that he'd worked all his life, and he never thought he'd end up putting a needle in his veins.
So, Sam, how did the purveyors of the heroin down in Mexico figure out how to puncture the market in a place like Portsmouth, Ohio?
Well, I mean, mostly they came to Columbus. But, you know, I think what happened here was pure coincidence. Basically, there's one guy who did it, one man. And I interviewed him at length. And I think I've confirmed through various sources, DEA and others, that he was the guy who did this. Before the late 90s, you had no heroin in this area at all. I talked with the guys at the Comp Drug, the methadone clinic, and guys who go back many, many years in this, and we had no heroin. It was the stuff that would come would be the worst quality, you know. So in backtrack a little bit. One man, a Mexican-American guy from San Fernando Valley in California, a longtime heroin addict. I tell this story in the book, but finds himself in prison in Nevada, where he meets a guy from this one small town that is so important in the story, I believe, Jalisco, in the state of Nayarit. Nayarit is a state about 12, 15 hours south of Arizona on the Pacific coast. And they have a conversation. The guy goes, we have this system, the guy he meets, we have this system that my brothers and my cousins are using in Honolulu and Denver and Portland, various places, where we sell heroin. It's kind of like pizza delivery. We have, very crucial to this system, access to all the supply you'd ever want to use, because heroin poppies have been grown in Mexico since the early 1900s. They grow very nicely in the Pacific Coast mountain range, the Sierra Madre along the Pacific coast. And we buy the opium goo from the Indians who grow it, and they harvest it and they sell it to us, and we know how to cook it into black tar heroin, right? And we have this system supplying it like pizza, so the addicts call, and we have drivers driving it around all over. What we don't know, what we don't have, is somebody who understands the addict world. We don't speak English. We don't really want to speak English. We don't want to know anything about this country. We just want to sell dope. We need someone who has an entree into that world that could open up that world to us in a way. This guy was that guy. So they get out together, parole in 93 and 94. One guy gets deported, he comes back. They set up several stores. They call them stores, little crews. First in Reno, Portland, Salt Lake, et cetera, various places. Over several years, this guy gets very connected to the town. He buys property, has a wife down there, has a kid, loans money, offers jobs selling heroin in his stores to the poor kids who need work. And after a while, he's very connected in this town. But at one point, he meets a guy in Reno who tells him, you need to go to Columbus with this stuff. If you go to Columbus, you will make a million. There's nothing like this in Columbus. You will make a killing. And I got a friend, I've got an uncle, he hangs out at the methadone clinic. You go find him, that's what happened, basically. He decides that he is going to go off on his own. June 11th, 1998, he flies from California to Indianapolis first. There's a tornado. The reason I know this is there's a tornado. He describes perfectly this tornado, and there's reports from newspaper reports that describe in detail the same details he tells me. He doesn't know we don't know what tornadoes are in California. I'm terrified of tornadoes. I don't even know what the hell those things are. I prefer like any kind of earthquake is going to be fine with me. Just keep those tornadoes away. He feels the same way. He leaves, goes to Dayton, doesn't like Dayton, moves to Columbus. This is why these guys, I focused on these guys because they are the harbingers of a new kind of drug trafficking that does not use guns and not about shoot 'em ups and drug trafficking, the Bloods and the Crips or the Colombians, the way they all did things, or for that matter, the prohibitionists back in the 30s, or the 20s with their Tommy guns and the drive-by shootings. This is a new kind of drug trafficking that focuses on customer service, on marketing, on branding. And he brings that here in around about maybe July of 1998. And but another part of this story is that he's important in is that within a couple of months he brings a couple of boys up from the town. They're selling, they're doing their whole thing with the balloons in the mouth and the pizza the pizza style delivery and all that. And one junkie tells him, "Hey man, you got to go to Wheeling. You go to Wheeling, you will make a killing." And that's how these things spread. The word of mouth, you need to go to over here, you'll make a killing, and that's enough for them to go. This guy goes to Wheeling and he meets a woman, he tells me, who's a heroin addict, who has a house and a new truck. And he had never met a heroin addict who had a house and a new truck. And he's like, wow, how'd she get that? And she then tries to trade him a bottle of pills for his heroin, and he looks at the pills, he has never seen this before. What is OxyContin, he says. Well, she is an addict, he's an addict, they speak a language that you and I just don't speak. And they begin to have a conversation, and she tells him of all the properties of OxyContin that are so much like heroin. And she begins to say, if the people who are on OxyContin soon will be heroin addicts. And he is the first one. These guys with their system, but this guy in particular is the first one to figure out the new pill market, and the pill market that is then going to become a heroin market if they just hang out, if they just are patient and push it and give away free samples and hang out at the methadone clinic giving away free dope.
Right, because even as you know, the Attorney General's office is doing this work to curb the tide of the prescription drug market. There isn't necessarily the backdrop there's nowhere for people to go because they're still addicted, right? I mean, Paul Coleman?
That's absolutely right, Ann. What we saw is the progression from prescription opiates, synthetic opiates, to heroin, and we think right now that heroin is clearly the drug of choice for most patients that we see at Maryhaven. And Sam's got the history right, because if we go back to 1997, 1998, we ask our patients at Maryhaven, what is your drug of choice? And to be honest with you, many of them will say, and it's unprompted, pretty much anything I can get, but my preference is, and we write that down as number one. In 97, 98, about 20% of our patients were saying opiates, which almost always meant heroin. These were older patients who had a long experience with the drug. And just in 2014, 75% of our patients at Maryhaven tell us that heroin is their drug of choice.
I suspect that's also younger folks who have gotten addicted like in the last, 15 years or so?
Well, you know, in some cases, Sam, tragically within the last year or so.
Well, yeah.
Because they're still being prescribed the pills for legitimate reasons at the beginning.
Well, they are still, despite the good job that we've done here in the state of Ohio, there's still some diversion going on, and I would call the attention of everyone here to the efforts our community has made through chain pharmacies, through drugstores, through grocery stores, to basically say, if you have prescription opiates and you're finished with your prescription, but you have some left over, don't leave them around. By the way, about 15% of our adolescent patients at Maryhaven tell us that opiates are their drug of choice. Fortunately, that breaks down to the vast majority being prescription drugs. But how do they get the prescription drugs? Not like adults, not through legitimate prescriptions. They get them because the drugs are diverted from legitimate sources, most often from somebody who steals them from a relative.
And because the people are being prescribed far too many of these pills for what they actually need. And almost all those pills, though, pharmacy robberies are just minuscule. They're very small. It's almost all those pills have been prescribed at one point.
That really resonated with me after I gave birth. I had one stitch, and they gave me 80 Vicodin.
Yeah,
I didn't even know what it was. Did anybody else out here have that experience where you get lots of drugs for nothing? Yeah. I mean, but not anymore.
No.
I don't know anymore. I know I got my appendix out in 2009, and I got 60 Vicodin to take home with me, and the message in that bottle was kind of the message of the modern medicine today, or for many years, which was these pills are virtually non-addictive when used to treat pain. That's the message when you get 60 to take home with you.
Where did that message come from? You write about that at
Right, that's a big part of the book, because I entered this story, I backed into this story because of my experience in Mexico. I was all about, the question was all, how is it that so many Mexican heroin traffickers are doing such banner business, and why are the seizures way up at the border and all that stuff? Why would this be the case? I had been a crime reporter years ago. It had been a long time, I thought, since heroin was anything but a kind of a, it was a 70s, you know? I grew up in the 70s. When I was a kid, I watched all those movies, you know, French Connection and Serpico, great movies. But that was the last days of the heroin problem, really.
Back in the 70s.
And so my question was, coming from 10 years in Mexico and extensive traveling throughout the country, why are these guys doing such banner business, you know? And all the pain revolution that I then talk about in the book happened while I was in Mexico. I was oblivious to it. I had no idea what this was. But come to find out that there was this revolution in modern medicine brought by probably well-meaning people who had lived through a period when opiate painkillers were never used for any reason. That was equally bizarre. People could be in a hospice, palliative care, dying of cancer, horrible pain, and still they wouldn't be given these pills because there was this really, really fierce stigma attached to addiction, or fear of them getting addicted, even though they maybe only had 6 months to live. You know, so doctors who grew up watching that were seared by that experience and horrified by it, and their idea was, we've got to do something to liberalize the use of opiates. So what they do is they begin a kind of a, really, it takes on almost like a religious crusade, a kind of a fervor to change the way people, doctors in particular, their attitudes and why they should be prescribing more. We've got an epidemic of pain. They turn to some very, very thin, extraordinarily thin, I hesitate to even call it research, there was no research, but papers that mention that maybe this isn't really a problem, that you can prescribe these pills without much addictive risk, and they hold that up as proof. And really, two or three of these documents convince an entire generation of docs, med schools, et cetera. So there's a whole bunch of other factors that go into it. But basically what ends up happening is conventional wisdom is these pills are virtually non-addictive when used to treat pain. They are, the other buzz phrase is less than 1% of all patients prescribed these pills get addicted. And so you have then a kind of a one-size-fits-all approach to pain management, which is just blast pills at it. And all of a sudden you get pills prescribed for a crazy thing. I still to this day do not understand why you would get any pills at all to get after wisdom teeth are extracted. And I got all my wisdom teeth extracted, and I got Advil. I didn't see a problem, you know. And now you get Vicodin. And then the other thing is, no one explains that when I had my appendix out, they gave me a big whack of pills, you know, And it was no explanation of what hydrocodone was, which is the active drug in Vicodin. No explanation of what I should do with those pills. Nothing. Just take them. It's fine. You know. And this is so. The story, the question that I posed initially, why are these guys from Mexico doing this great banner business? I had to go even farther back into a world that I did not know at all about, you know, the whole story of pills and pain management and the pain revolution. And so this drug scourge ends up being unique in the history of drug problems in America since World War II, which is the only one that did not start with the mafia, did not start with drug traffickers or street drug dealers, and rather started with legitimate medicine.
All right, so let's make another leap here, though. What accounts for the surge in heroin overdoses? Is this a different kind of heroin than we knew of and heard about back in the 70s?
Well, Ann, it is. Forgive me, but it's a good analogy to marijuana, which is a topic of discussion these days in our state. The marijuana that we have today is much different than the marijuana baby boomers grew up with. And that's the case with heroin also. It is stronger, and realize what pushers do. Pushers sell a product, and they have to differentiate that product. Sam has given you a great description, you know, in the book about how the model is pizza delivery. And that is true throughout all the communities in which Maryhaven does business and throughout the state of Ohio. But the point is that pushers differentiate the product. A recent troubling trend has been the mixing of heroin with fentanyl. And that can be extremely, extremely dangerous. It is anywhere from 30 to 50 times more powerful than opiates. And the Ohio Department of Health says that this accounts for the rise in heroin-related deaths. So we've talked about the problem. Can I have just a couple minutes to talk a little bit about the solution from the demand reduction side?
Okay.
Can I do that? Okay. Because I think it's important to know. The problem is huge. It requires two responses. We've talked a great deal about supply reduction. And Sam, I think we're doing a good job here in Ohio getting those pill mills closed, changing the way physicians prescribe. So I think we're doing a good job in terms of supply reduction. Demand reduction is the business I'm in at Maryhaven. And what we find is good responses in helping us do our job from both the state of Ohio and the counties in which we do business. The Ohio Department of Mental Health and Addiction Services has a focus on eradicating demand for opiate use by funding innovative types of programs, such as the use of Vivitrol, which is a medicine that we use at Maryhaven that helps addicts get off opiates. The Franklin County Adam Board here in Franklin County has invested over nearly $10 million in care for patients who are seeking help so that they no longer have to use opiates. And I'd like to point out that the Franklin County Alcohol, Drug, and Mental Health Board does have a levy on the ballot in November. It is issue 14, and I would respectfully request your careful consideration so that we can better care for people in our community who see the problem in themselves and want to do something about it.
Can I say one thing about what Paul was saying before?
Yeah.
And that is that, the reason that heroin is has been more potent is because it comes from shorter distance. When I was a kid in the 70s, our heroin, most of it came from Turkey, Burma, places like that. In the 80s was another major change, Most of our heroin began coming from Latin America. Heroin is a commodity. It obeys the price and a lot of that, it obeys a lot of things having to do with cost of getting the drugs here. And so if you have to come from Mexico, it's a whole lot cheaper than coming from, say, Burma or Afghanistan or Turkey or wherever it was coming from before. The other thing that governs the price of heroin is how much it gets stepped on. The longer distance, the more people you have to sell to, the more it gets diluted, and the weaker it gets. But heroin from Mexico and to some degree Colombia has to go through far less of that. I would say my hunch is, although I'm not, and that's why we have heroin that is cheaper than ever. Okay, you can maintain a heroin addiction for about 50 to 60 bucks daily today, whereas before it would be well over 100 in the 70s and 80s, I think. But again, keep in mind that heroin is a commodity, and the way you change it is by what you add to it. And so fentanyl, to my mind, is a desperate measure. It's probably people who have had their bought heroin that's been stepped on so much that there's not any heroin left in it. And so in order to boost it, you got to add something to it that'll give it a boost, because otherwise word will get out and no one will buy it from you. It probably also is because word now is out that it's extraordinarily deadly, is probably people selling it one time. It's not people who have a business model based on continual daily sales to their customers. They want to keep their customers alive, obviously. It's not altruistic, it's business. It's business, pure and simple. But it's also very good business to keep your clients alive. So selling heroin with fentanyl in it would seem to me to be a desperate measure by someone who doesn't really care. It's got a certain quantity, wants to get rid of it and move on and not have a supply, a bunch of customers who are you want to cultivate and continue to keep alive. That's my comments on.
Okay, it is the Columbus Metropolitan Club's tradition to take audience questions. Please step to the microphone, give us your name, and ask your question. And thank you in advance for not making long editorial comments. So please step to the, and in the meantime, if no one else is going to ask, but please do.
The microphone's over there.
Microphones, I'm sorry, they're right over there.
Hi, my name is Felicia Lillian. I had a quick question. You'd mentioned pharmaceutical regulation and medical treatment as solutions to the problem, and I was wondering if you had any opinion on legal policy and whether or not criminalization or decriminalization of drug use had a negative or positive effect.
That's a really great question. Paul Coleman, any thoughts about that? Or?
Yes.
Okay.
I have some thoughts. Western society for 5,000 years has legalized one drug. It is still the drug of choice, running a close second to heroin, and it is called alcohol. Most people can use alcohol safely, some people can't. We have one legal drug. I can't see what we would gain as a society from legalizing other drugs. There are massive public health concerns in doing it. There are law enforcement concerns in doing it. There are workplace safety concerns in doing it. And finally, yes, there are the children. And once we legalize something, we say, okay, it's okay. And I think as a society that we're doing just fine with that one legal, very potent drug. Most people, again, can use it very successfully, but I just don't see any advantage in further legalizing drugs.
Sam?
Wow. Well, yeah, my feeling is that folks who have thought, who have proposed legalization have not thought deeply enough about what needs to be done. In California, we have probably one of the worst marijuana laws in the country because it said, oh, marijuana is legal because it's probably a medicine, and go ahead and, you know, whatever kind of thing. Really, that's kind of what I read the thing going, what kind of law is that? I was in Mexico when they passed it, all right? I didn't vote for it, all right? But there's some other issues, too, that, first of all, with regard to marijuana, it's now, marijuana is now 20, 30, 25, 30% THC. That's the active compound in marijuana. That rises to the level of LSD, in my view. 30% THC marijuana is like a recipe for disaster. However, the way that happened was through prohibition. That's why we have 30% marijuana, THC marijuana, right? You had this during prohibition of alcohol, too. You had all kinds of wacky alcohol, that wood turpentine and all this kind of stuff. There was no regulation. The people who have proposed, however, regulation, legalization of marijuana, in my view, have not thought deeply enough about all that needs to be done if you're going to do that. I happen to believe that marijuana probably needs to be legalized because I'm afraid, I know where Mexican drug cartels get most of their money. It's from marijuana, okay? And the other drugs change. Marijuana is constant. That's where it is the gateway drug for all Mexican drug traffickers. That's how you get into drug trafficking, selling marijuana. The problem is that people, again, are thinking like, well, all marijuana should just be legalized. I have no, in no way support the idea that you should legalize even 10% THC marijuana. I think it should be, you should use the alcohol template. Beer is what, 3%, wine's 4%, or whatever, maximum 6%. And that the money, the other thing that people have not thought deeply about is the regulatory scheme that you are going to then have to fund. Because Paul's right, that the drug that ends up being legal is the drug that people are going to use most often. And alcohol is a perfect example of that. So if you want to legalize marijuana, you also have to, within the framework of a law, talk about how you're going to pay for all the inspectors to go out and make sure that all those weed plants are growing nothing but 3 or 5% THC marijuana. CHP, or what do you call it here, Ohio State Police or Highway Patrol, to train them in how to view this. And then, of course, an enormous public safety, publicity campaign telling people not to use it because you don't want people to use it. You don't. Legalizing it does not mean you want people to use it. So my problem is I'm not sure how I feel about it, but I do think that the people who have, at least in California, who have proposed legalization have really, really not thought deeply about all that goes along with legalizing some of these drugs. And all that money that's supposedly the state's going to recoup in tax money, all that's spent ahead of time. And for probably a decade at least, maybe 2, while you're creating these new bureaucracies and these new strategies and so on. When it comes to heroin, whether we should legalize heroin, my feeling is we already have a legal opiate for maintenance of addiction, and that's methadone. And it's got its drawbacks, it's got its good and its bad, but it is not, heroin's euphoria and crash goes like this, several times a day. Methadone's like this. You can actually have a life where you think about other things besides dope on methadone. I don't suggest people go out and get addicted to methadone. I'm just saying that you've already got a legal opiate. And why heroin seems like the only reason heroin survived past like 1915 is because drug traffickers learned that it was a really great drug for selling illegally on the street. It's not a good painkiller, really, or its benefits are far outweighed by everything else. And so my feeling is if we already have a legal opiate, it's actually a pretty good thing. You go to most methadone clinics are widely varying, and some are awful and some are great. But it's dirt cheap, it's liquid, you take it, we've got that scheme in place, and I'm not sure what legalizing heroin would serve, basically.
Thanks for that question. Appreciate it.
Hello. I'm Dr. Chris Sherrington. I actually practiced anesthesia, graduated medical school in '98, right when the decade of pain was about to begin. Yeah. We were taught in medical school that we were causing the elderly and the invalid to suffer by not prescribing enough, and that was pushed actually quite heavily in residency. But the reason we were taught was that the legal system for the previous 15 years had been actually incarcerating physicians for not treating pain. So in some ways, our response to not treating enough pain was to scare an entire generation of physicians into doing it. And that's, I just wanted to make one comment. Do you see the reverse as part of the solution for the society as we start to prosecute for over-treating and then by the law of unintended consequences causing those relatives to disperse drugs? That's really one question. The other one is, what role do you think naltrexone or other fast-acting reversal agents can play in preventing youth death from opioid overdose?
Doctor, I'd be happy to quickly respond to your last question first. Naltrexone is a very valuable medicine to use for people who are experiencing problems with overdoses of heroin particularly. So I think we ought to look at that, and indeed we are in the state of Ohio. It's now available without prescription. That's a good thing. It saves lives. I'm in the business of treating addicts. I can't treat addicts if they are dead. Your first question, I think, is well taken. The law of unintended consequences is running rampant throughout this entire problem. And I think we have to look very carefully now, particularly physicians who specialize in pain management, to make sure that if we do bring the sanctions of the law against them, we must have very, very clear evidence that they are violating acceptable standards of practice. Your point is well taken, Doctor.
Thank you.
Hi, my name's Tia Moretti, and my question is about treatment and capacity. So if my loved one or myself, I want to receive treatment, how are we addressing that ability to get them in when they're ready or when I'm ready? As it stands,
keeping them there long enough to really address
yes,
it. That's the
exactly,
length of time
and
is
making
big
sure it's a
problem.
comprehensive treatment program.
Yeah.
So what are we doing in the state of Ohio about that and to address it?
It's a very good question. It's something that I don't think about daily. I think about it hourly, because Maryhaven, like any other provider of behavioral health care in our state, faces great overdemand for services. It's always facile to say, well, the answer is more money. But I think you need to look at the capacity of the behavioral health care system in our state as well as nationwide. That's a long-term solution, but you need to look at it. The other thing that you need to look at is the capacity of our medical education system to produce the healers that we need in the business. All that is well and good, and I tell myself that all the time. But when I get a call from someone like you who has a loved one, and I say, detoxification at Maryhaven has 24 beds. We now, today by the way, today we have 28 patients in a 24-bed unit, okay? And I say, let's get the patient to be on a waiting list. We'll work with that patient. We'll get him or her in as quickly as we can. That's not a good answer. And I wish I had an answer, and I'm sorry.
Can I say that on that topic, one thing, I don't know a whole lot about the ins and outs of treatment in Ohio, defer most definitely to Paul on that, but I think what this epidemic is doing on another level is really forcing us to rethink the form that jail takes. Jail is a cost now. People are put in jail to await their trial, or they're doing their misdemeanor. In California anyway, this is how it works. You know, you do your misdemeanor time in jail. And it's largely, you spend it in a vegetative state, talking about your criminal past with all these other guys, trying to avoid fights or get involved in fights, depending on your nature, and bartering stuff. And it's entirely non-productive, entirely big waste of time. I'm quite sure that Ohio is like the rest of the country. It's been overwhelmed. Its infrastructure, rehab infrastructure has been overwhelmed. There is, though, I think, rethinking jail to include not as a current way it is, you know, where you've got occasional volunteers show up to do a 12-step meeting, or a preacher shows up to do some prayer or Bible study or whatever it happens to be, but actually converting wings of the jail to effective rehab clinics. They're doing this, saw this in Kentucky in a few jails, and that is the way to relatively cheaply. They're doing it in Kenton County and northern Kentucky without really asking for more budget. Converting a wing of 70 beds to entire rehab. And what I mean by that is rehab from the moment you wake up to the moment you go to sleep. You're working on your rehab. You have to apply to be a part of that wing. You wake up at 6 in the morning, 6:30, you make your bed, you do those. There's time for physical exercise, there's time for prayer and meditation, there's 12 steps, a variety of things, there's GED classes, etc. All of this with an eye to making jail into an investment instead of just throwing money down the drain, which is what it is today. It's just a cost is all it is, right? And so opiate addiction in America, I believe, is forcing this on many communities that had never thought of this before, or never thought that they had to, never really given the thought to what shape does jail take when my boy's in there? Is it just vegetating and talking about where to get the best dope when you get out and all this stuff, or is it being among people who are all motivated that way? Will it work for everybody? Well, I think we know that relapse is a big part of this story. But no, maybe not. But it certainly seems to me to be a way where you can convert relatively quickly and relatively cheaply new bed space, new infrastructure into or just come up with new infrastructure for this problem, because this is the problem across the country, and really what it depends on, almost more than anything, is a change of mind, a change of political will. People saying, really jail's a waste of money right now, and what we need to do is try something different, and maybe it will be an investment, so that in the long run, we will have 25% of those guys not coming back, whereas probably before, all those guys would have come back, so.
Okay, we have
that's an
time for
idea.
just one more question.
Thank you. Jane Scott. Quick question, maybe a bit of a rhetorical question. Maybe it's a question for all of us. How quick are we to ask for a pill, a prescription, instead of looking to our doctors for maybe some other solutions to our aches and pains?
Jane, I think we should all ask our healthcare practitioners, when something is prescribed, is this the least aggressive intervention we can start with?
And I also think we need to ask ourselves, what is our own responsibility and accountability in our own wellness? We need to say, I'll stop drinking soda. I'll start walking more. I'll definitely stop smoking. I don't understand anybody who smokes anymore, honest to God. We have spent a lot of what doctors are facing. A lot of reason they turned to pills was because they had patients who were demanding that doctors fix them, and there was not a whole lot of accountability or participation in your own wellness. On the part of patients, they just wanted the doctor to push a button. The only way to push a button is with a pill, and we all know where that leads. So I really do believe we need to give doctors a break here a little bit, as American consumers, as Americans, for whom the idea of accountability is a fundamental part of our system and our history and our culture, and say, we'll be accountable first for our own wellness, and then, we ask all the right questions when we get them, and what is hydrocodone, that kind of question is, of course, valid.
That's it. The book is called Dreamland. Thank you so much. I read the whole thing. So, Sam, thank you so much for joining us. Paul Coleman, thank you.
What a wonderful discussion. Thank you to each of you. I hope that you all enjoyed today's forum. We encourage you to continue the conversation in the lobby with coffee and cookies. Remember that you can view and share all of our forums on CTV, Columbus Television, on WOSU and PBS affiliates statewide through the Ohio channel, and anytime on CMC's website via YouTube. Let's thank our sponsors, the Center for Community Solutions, Cardinal Health, and our speakers, Sam Quinones, Paul Coleman, and Ann Fisher. And thanks to all of you for being here. We look forward to seeing you at CMC again soon. Have a great afternoon.